Guys, this is the first time in MedSpa marketing group chat that we have talked about plastic surgery and marketing for plastic surgery, which is crazy because we've been marketing for plastic surgery since the beginning. Isn't that fun? So I've got Andrea, CMO, and I've got Mitch, Director of Digital Marketing, to kind of discuss strategies for plastic surgery, which in a lot of ways, it's like the final boss. If you have it, right? It's the top of the mountain. It's the longest journey that we are marketing to and for when we're marketing to and for it. And so let's kick this conversation off to set the stage with some data. Andrea, what is data showing us right now about where the trends are organically with plastic surgery?
Yeah, so I pulled some data in advance of this discussion to look at the 5-year view of how search demand is gauged by Google Trends. Looks for different surgical categories. So I pulled for facelift, bleph, breast augmentation, liposuction, and mommy makeover, and hair transplant. And what's interesting is we've actually seen liposuction falling from grace since 2021. And it's flatlined about the last 3 years, give or take. There's some variance, but that's actually dropped while, by contrast, facelift has really taken off over the last couple of years, going back to about Q1 of 2025. We have seen a bit of a comeback on breast augmentation. That had fallen off around 2021, 2022. We all know what was going on during that time period, so no big surprise there, but it held steady in search demand all the way up until about Q4 2024, Q1 of 2025, and that started increasing in popularity again. Mommy makeover has actually held relatively stable over the last 5 years by contrast. Bleph is another surgical procedure that has really gained popularity over the last couple of years. Now, in comparison to the other categories we just discussed, smaller search volume, but still noteworthy in its growth trajectory. And then finally, I did want to hit on hair transplant. That's another one that has really taken off in the last 2 years. So I think it's good to just have that macro view of the direction things are going. It's not this linear curve either. It's a pretty dramatic uptick. In particular, just 2 more details on the data front and we can move on. Facelift, it's flat until about that first quarter of 2025. And it starts more of a linear trajectory. If you look specifically at deep plane facelift, that one's like a step function jump starting in what looks to be around Q2 2025, just a sudden surge on that particular subset of facelift. Bleph also had an interesting pattern. It started gaining popularity about early to mid 2023, but what started emerging were these December spikes. We see a sudden spike in December of 2023, step function improvement, flat through the rest of 2024, but then December 2024, another sudden spike, and it comes back down flat for the rest of 2025. Interesting difference in 2025. There's a smaller spike. It starts earlier in Q4 around October. Doesn't spike as high, but there's still a step function improvement to date in 2026 compared to prior years. So if there's one thing that we should take away from that is just looking at the macro trends alone, and we'll talk about customer journeys and the decision points, the inflection points that lead you to these different procedures. Taking a one-size-fits-all across different surgical procedure marketing is not going to be the right route.
Right, exactly. I mean, I think what's interesting, because you mentioned deep plane facelift in there, that there's these perhaps new flavors. Deep plane facelift, I don't know if we can call that a new flavor, but at least the trends would suggest that organically people are searching for that.
Awareness is increasing.
Yeah, and uh, it's interesting to think about how AI and conversationally, there's other means at which people organically are finding these treatments, and finding what's out there. But I get what you're saying, that like most things, there's nuance across the board, and like the conversations that are happening with bleph and the increase of bleph for whatever that reason is, the spikes that happen in December, and then the stepwise increase, like, isn't necessarily happening over with mommy makeover, but there still is appetite across the board for these procedures.
And one more thing to bear in mind is just understanding the nature of what drives the demand for these procedures. When you look at facelift and bleph, that's more of an anti-aging measure, right? Whereas when you're talking about liposuction or breast augmentation, that's about improving your silhouette. That's more age agnostic.
Mm-hmm.
So that's an interesting nuance to keep in mind if you're promoting multiple types of surgical procedures. The need state and what triggers people to want to explore these different options, it's going to be different. Same thing with hair restoration. And we also talked about mommy makeover, that's more of a milestone moment in a woman's lifetime that triggers the need for that. So just understanding the need states for these different procedures is going to color the way that you go about crafting a marketing strategy.
Mm-hmm. Yeah, I think that surgery is often, as we talked about at the beginning, viewed as the end point. But I think that's a really important point, is that it's not just the final destination of the age reversal process. It's also structure changes. Like, thinking about the patients who come in and they have a rhinoplasty because they've been made fun of with their nose for their whole life, and then being able to document that transformation. That's also age agnostic. We've had 18-year-olds even we've done a marketing campaign for that was beautiful, watching her journey with that, and that's at age 19, 18, right? And so it's not just a endpoint anymore necessarily. It's also looking holistically at all age ranges. There's also people who are at the beginning of their aesthetic journey too that might want that.
Yeah. Okay, sweet. So we have this patient journey, and this is the first time talking about plastic surgery. We've been talking about the patient journey of the med spa patient. Let's talk about what makes the plastic surgery patient journey unique or special from the med spa patient journey. I'd say from like a headline, it's a lot longer, right? But can you guys like kind of identify, and maybe we can break this out step by step of the funnel or the journey, and yeah, let's spend some time unpacking what each step kind of looks like.
Well, the journey has evolved for surgery in recent years. I think if you want to start at the very top, at the very beginning of that journey, there's awareness and discovery that's taking place, right? More so than ever, the landscape is just increasingly saturated with this wealth of content. The providers themselves, but as well as patients who are openly sharing about their experiences. There is so much content to consume now that people are becoming aware of and increasingly more actively interested in these procedures just by virtue of the fact they're being bombarded with this content. So I think that that's an interesting dynamic. In a way, that's good news for surgeons who maybe aren't quite as forward with content because they can ride the coattails of other people who've been more prolific in getting content out there, not to mention just non-incentivized, non-sponsored content where people are organically sharing on the subject matter or their experience. So some of the awareness marketing is being done on your behalf by everyone else out there who's publishing. Yeah. So that's an interesting factor. And then what's really interesting in this research stage of the journey is with the advent of AI, people are now doing pre-consultative sort of interactions with AI chats. So they're able to place a lot of their questions there, get some early insights into all of the things that have been on their mind in relation to these procedures. You can even upload photos of yourself and ask the AI to simulate what a procedure would alter about you. It can even render.
I can hear plastic surgeons grunting when they hear you mention this, like, oh no, this is the problem. AI is misleading everybody. But to your point, like, that is available for patients. Patients are going to be using it. And part of that is just introducing the conversation. These conversations are taking place, right?
Right. So nowadays, this is so different, most likely from even just 5 years ago, which we were looking at. The initial touch point that you're going to have between your brand and that patient, at least one in more of a lead capacity, they're coming in differently than they would have come in 5 years ago, more than likely. And to your point, the surgeons groaning, they've been thoroughly informed and perhaps also misinformed along the way. So you do want to make sure that you're seizing control of the narrative, but also you want to establish that relationship, even if they're still not a super high intent lead. If you can capture them and then nurture them thoughtfully and take control of the narrative, that is gold.
Yeah, Kevin, you mentioned that everything is longer when it comes to treatments when you go under the knife, and that is accurate. I think from all portions of it, the assessment phase of who do I actually trust is much longer, probably because of the permanence of the nature of surgery, right? You can't undo it. You can't reverse it. And so I think there's just a lot more weight that you put into who am I going to choose and trust with my lifetime appearance, right? And when it comes to Botox, we've talked about this before. Botox has almost become like going to a barber, going to your salon, right? And it's like getting your hair cut. You go in, you try a new provider this time, and they gave me a little better result the last time. Okay, I'm going to choose these guys. It's a little bit more like I'm scoping out and trying different people versus this is like a one-time thing, especially if it's a deep plane facelift or something like that. So when you think about marketing, it is a nurturing process from the get-go, even from the initial ad, right? And the content that people are seeing. You are fighting, to your point, Andrea, with all of this other information. And so how do you actually get somebody from not aware to now I trust you enough to actually contact you when the time is right? And Andrea, we've talked about nurturing campaigns and lead magnets, right? So I'd love for you to hit on that just a little bit.
Yes, on the lead magnet front, again, the game has changed a little bit since so much more content is out there. And you also have AI as this ersatz Q&A tool where people are proactively seeking answers from these virtual agents. And therefore, what could have been a successful lead magnet in the past, like a PDF guide, you're going to have to craft that very thoughtfully. And more than likely, you're going to have to tease some content to illustrate why they should download that kind of guide when they've likely encountered a lot of the same information already in this interactive AI format and other content means as well. I don't think the PDF guide is dead at all. I still think it has a place in the playbook, but that's an example of a lead magnet. You're offering valuable information in exchange for them giving you their contact information so that you have an opportunity to forge this relationship with them. I think that the live streamed events, and even on-demand webinar type content, that's a super attractive lead magnet that surgical practices can be capitalizing on. And again, it would behoove you to take highlight snippets of that, sound bites
for socials and all that.
Take some sound bites, maybe even maybe some kind of montage even, but tease the content such that people are going to be enticed to watch the full format, but gate it with a lead form.
Yeah, and I think that's also a bit more impervious to AI's advancement. I mean, maybe nothing is impervious to AI's advancement ultimately, but at least we can confidently say that the content that comes from a PDF or that is generated through PDF, like we're already starting to get a sense of how AI can influence that. I want to say AI slop, which I'm not suggesting that all PDF opt-ins are AI slop, but the appetite will decrease the more saturated that content becomes, and it's getting that way. Such is not the case for long form content, like you were saying, that is live streamed, live streamed is the ultimate, but even just, we have a partner who does a tremendous job posting the entire procedure front to back. And I remember hearing like one of our plastic surgeons say early on how surprised they were that this shift is happening with culture and with the patient body, that they like want to see the blood and guts, right? They want to see the graphic stuff. It's like, I would have thought that you'd want to like keep the facelift behind a closed door and just show me the result. No, actually people are wanting to see all of it. And I think because they're wanting to feel like they know what's going to happen. They want to trust you, right? And so as far as AI is concerned and its influences on potential strategies for opt-ins and gating content, yeah, that long form video content, I think it's great for gated. And like you're saying, it's also great for chopping up for a variety of other purposes.
And I think another aspect of that makes it so appealing to the audience and why they would want to engage, it's not just educational, but it's also giving first-person perspective that AI can't honestly do. They aren't a surgeon themselves.
Mm-hmm.
So that first-person testimony of the doctor, and we can't overlook first-person testimony of patients.
Come on. Yeah, I mean, we've talked about this a bit, but I am so heavily influenced by Donald Miller still. Donald Miller is the author of the Story Brand. The premise of Story Brand is that often the hero is made out to be the business. In this case, we're talking about the provider or the doctor. And it makes sense that you would spend so much time credentialing and hoisting up the platform for this surgeon. After all, the surgeon has the knife and also controls like the, anesthesia or whatever. Well, I guess that's the CRNA, but has a lot of power and a lot of reason for credentialing. However, as StoryBrand would suggest, the hero is not the surgeon. The hero is not the provider. The hero is not the brand. The hero is actually the patient in this case. And so when we think about the role that the patient is to play in marketing at every phase, the patient isn't the afterthought. The patient is actually that main course. And how do we serve up content such that the provider, in this case plastic surgeon, is the guide in that whole experience? That is essentially what the Story Brand framework would say.
Mm-hmm. Yeah, I think it's kind of two-pronged. And if we could just dip into the actual ad content pool for 1 minute.
Pop off. Slay.
The things that I've seen work really well are actually right now talking head videos of the doctor, of the surgeon. And it's methodology based. It's what sets my technique apart from any other doctors that you might go out. And Story Brand, like, where is the hero versus like, can we never talk about ourselves, right? That's an important differentiation, is like, you're the expert, right? The surgeon is the expert. So it's important to make sure that the person that's accompanying you on this hero journey, yes, you're the hero as the patient, but make sure that your guide knows how to.
This is a good guide.
How to cut in your face. And so the technique is important, right? Who I trust as a surgeon, that's very important. And so I think having those talking head technique videos, people are responding to that. And that's not just theory. That's like the cost per acquisition is actually very low comparatively on those types of campaigns. So those are working right now. The other thing though is, to your point, if I'm a patient, I want to see myself in the people that you've treated. And so if I can see talking head videos of them as well, seeing their before and afters, those are also performing very well right now as well.
For sure. Yeah. Okay. So let's go back to this funnel model. So we kind of discussed kind of high level the content that would feed patients into the funnel, and now we're starting to get into that funnel space where we've got them captured, got them engaged, we've got a touch point, perhaps in trade off of a PDF, or better yet, some other kind of high quality gated content. But now that we've got them, now what are we going to do with them? And I think this is really where the length really starts to show itself. And the handoff that takes place between marketing and sales, one of the things that, Andrea, you mention all the time, and I love it, is that sales and marketing are the same thing, that we don't live in a silo. Marketing is kind of everything. But can we kind of discuss best practices with like how to move patients through the funnel here?
Right. And I think for efficiency, we can address this through the patient journey lens. Mm-hmm. And there's the business side analog, the funnel and the facilitation of it on the practice side. So the customer, at that point, we have that initial establishment of the relationship. So begins on the business side, the nurture sequence. So throughout that, we're deploying comms through a mixture of channels. There can be some light retargeting through paid ads, but largely leveraging free channels to continue feeding them educational information, continue reinforcing credentials and other trust-oriented content to gain their confidence, to nudge towards ultimately having an official consultation. And another call out, again, on the business analog side of things, you want to protect your PCC's time and your surgeon's time for that matter, and make sure you're qualifying leads and compartmentalizing within your CRM to ensure that we're only sending qualified leads over to be contacted for that sales type of engagement. And I like to say sales is an extension of marketing. We really are all one team.
All one team.
So,
for sure.
There shouldn't be any animosity between these teams. You should be constantly talking to each other. And if too high of a volume of unqualified leads is reaching your PCCs, marketing needs to welcome frequent feedback so that we can recalibrate.
Yeah, for sure. And all of this takes a long time because it's such a big investment, regardless of if you're young or if you're older, depending on what your investment is. This is a huge deal. And I think as we kind of look forward to after the procedure and just recognize that the amount of time that it takes to steward a patient all the way through the procedure, there still is healing time on the other end that needs to be accounted for as part of that patient journey, because that review that concludes this whole journey is so valuable. And it's different than a med spa where it's different than a Botox appointment, I should say, where you have this opportunity to kind of move through and carry along this treatment journey. It's a one and done thing. So how are you maximizing the procedure? Well, you're maximizing it with a review.
Right. It's important to bear in mind that the med spa business model is different. You are counting on recurring revenue, whereas on the surgery side of things, it's typically going to be a one-time transaction, and all of your margin is going to be captured at that point.
Yeah. So I guess what that means is, in many ways, the review, the referral, and however that experience gets stewarded at the end, that to me is really the end all goal.
Exactly. So even though you're not looking for recurring revenue off of a surgery patient, what can keep your future books full is getting that testimonial from them, getting that before and after, and that helps feed the flywheel. It's just a different approach than what you would take in the med spa environment.
Mm-hmm. Not to mention the fact that if you capture it, you can repurpose it for life, like as paid ads. We talked about paid ads. If you can get that referral,
send it back into the funnel.
Yeah, you send it back through at the end of the funnel begins your next your patient is going to start from a journey just from someone else's ending point, right? It's like,
Yeah.
I hear about how good of an experience that you had. Now I want to as well.
Love it.
So I think one thing that we need to call out that we've danced around a little bit, because the patient journey is so long, because there are so many touch points along the way, some of which are organic content, it makes it spectacularly difficult to quantify the incremental lift that some of your channels are providing up funnel. It's hard to attribute an ROI because oftentimes you're not directly able to attribute a touch point on that engagement, on that top of funnel content, such that it can be tied to downstream revenue. So that could be a whole episode on its own. But I think it warranted saying today that just be very careful about not writing off your up funnel content. Don't be overly skeptical of the investment you've made in providing content. It's probably helping you far more than you think.
Mm-hmm.
And just know that ultimate surgery and the revenue generated off of that, it's attributed to the sum of many parts.
Yes.
And so just do the very best that you can to have attribution on touch points. And the top of funnel measurement is its own beast that we can talk about in some other episode.
Another time. Yeah, for sure. Love it.